Hi folks, Dr. Israr Khankhel again, and today I want to talk about Mounjaro. The generic name is Tirzepatide, and this medication was approved for diabetes mellitus type 2 in last year in May 2022. And so I'm going to talk about the following things very briefly. Number one, what is Mounjaro, how it works, what are some of the indications that is used for on labels and off labels, and what are some of the contraindications, and what are some of the discussion that you must have it with your doctor before you get these medication prescribed for you. And we're going to talk very quickly about some of the side effects and some of the warnings and alarm signs of the this medication Mounjaro once you are on this medication. And I want to talk about also at the end of this video, where are we with the FDA approval process for the weight loss? Because you have to realize that this medication was approved for diabetes mellitus type 2, not for diabetes mellitus type 1. And there was ongoing study going on to see if we could get it approved for the obesity. So, and at the end of this video, the last section, I want to briefly talk about what are some of the options that you have, how to get it approved, how to get it cheaper, and what should be your discussion with the insurance company, with the pharmacies, and with your doctor to get through the approval process if you could get it approved. So before I want to talk about this medication, I just quickly want to mention that I do not have any personal interest, or neither I am sponsored by any company. This talk is not motivated. My only purpose is to reach the people who are struggling with obesity or obesity related diseases, and that will be one of the addition to their information so that they can make more informed decisions for themselves. So first of all, number one, let's talk about, so what is this medication Mounjaro, or the generic name is Tirzepatide, which is probably the only medication in this class that was approved last year in May 2022 by the FDA, Tirzepatide, and it was named as Mounjaro. It is an injectable medication. It is usually given under the skin every week. That means the half-life, or they mean the effect of this medication lasts almost for a week, and then a week after you get the next injection, and so on and so on. So the next thing, how this medication works. So how this medication works, so that you can be able to lower your blood sugar. So there are four mechanisms that this one medication works via those four mechanisms. The first mechanism is that it's usually affect on the brain hunger centers. So the satiety centers in your brain are usually affected by this medication, so you feel less hungry, and as a result you eat less. That's the first effect. So the first effect of this medication is on brain, the hypothalamus, hunger centers. The next effect of this medication is basically it slows down the stomach. So when you are on this medication, it makes the stomach a little sluggish. So as a result, you feel more full and you don't feel hungry. So this way you lose less calories and less food. So that's the second effect. The third effect of this medication is that it increases the insulin sensitivity. What that means is that it makes the insulin more effective to metabolize your carbohydrates. And it also actually increases the amount of insulin released after a heavy meal. And how it does that? So basically what it does is that this medication is called the GLP-1 and the GIP analog. So the GLP-1 and the GIP analog medication, what it does is that it affects some of the receptors that we have in the pancreas to release more insulin in the bloodstream, and as a result, that more insulin is helping you to metabolize the glucose. Now, mind you that this medication usually does not release that insulin if you don't need it. So it usually releases that insulin when you have a heavy meal, and then this medication is in effect for almost 1 week. So the GLP-1 and the VIP analog, that's how it has a dual effect as compared to the other medication such as semaglutide, liraglutide, a class of medication, which are only GLP-1 analogs. Okay, so the other effect, what it does is that it decreases the effect of glucagon. So glucagon is another hormone that has the opposite effect of insulin, and it is released by the pancreas. So this medication inhibit the release of too much glucagon from the pancreas. And then the glucagon usually is a hormone that is responsible for releasing the glucose from the liver. So by inhibiting the glucagon, it's basically what it does is that it decreases the amount of glucose that is released from the liver. So that's another benefit for the diabetes. So these are some of the 4 main mechanisms that this medication act to help you to control your diabetes, right? So indications and effectiveness. So what are some of the indications? So the first indication is certainly, as we said, was approved for diabetes mellitus type 2. And the basis is that they did a 40 to 52 week study in a large amount of people who participated in that trial. It was called SURMOUNT phase 1 trial. And 70 to 90% of the people over a period of 40 to 52 weeks, they were able to accomplish a hemoglobin A1C of less than 7. So to consider the diabetes that is well controlled, usually we look at the hemoglobin A1C, which is, what is hemoglobin A1C? The hemoglobin A1C is a test that we usually do every 3 months. And that usually corresponds to what has been your average sugar running on the daily basis in the last 3 months. So in these studies, they were able to provide to the FDA enough data to suggest that the people who are on this medication for a period of 42 to 52 weeks, they were able to lower down their hemoglobin A1C below 7. Of course, this medication then was used with the diet and lifestyle modifications as well. So then it was approved by the FDA. Now, the other effect of this medication that was noticed in that SURMOUNT phase 1 study was that the people, not only they were able to lower their hemoglobin A1C below 7, but they also were able to lose about 25 pounds in that period of time. So that was a very big news that so far, most of the weight loss medications, their data was suggesting that usually you lose 14 to 15% weight loss with those medications, but this medication basically was suggesting that you could lose 15 to 20% of the weight loss over that 10 months period, 8 to 10 months period. So that was a significant study. So we will talk about further, where is the FDA in regards to the approval for the weight loss. So right now it is prescribed for the diabetes mellitus type 2, but it is certainly used off-label for the weight loss medication. But certainly you will have a tough time with insurance companies, as you know, that they're always looking for a reason not to approve something, generally speaking. So if you don't have a diabetes, you will have a hard time with insurance to get it approved. But Having said that, let's jump into what are some of the contraindications and what are some of the discussions that you need to have with your doctor before you have this medication get approved for you. So the first thing is that the most commonly talked about the contraindication is about the to make sure that you don't have the history, your personal history, or you have a family history of medullary thyroid cancer. So if you or your family have a significant history of any thyroid cancer or medullary thyroid cancer, then I will be very cautious and I will be able to share that information with the doctor. Certainly, that's almost a contraindication for this medication to be prescribed. The other entity is called MEN2. It is multiple endocrine neoplasia syndrome. That, if you have a family history of that disease, which is basically all the endocrine glands in our body. If you have like a different endocrine glands, if they have any cancer history in the past, then you need to share that information with your doctor, and that will be absolute contraindication for this medication to be prescribed for you. And this is true also for the other medications such as Wegovy, Saxenda, because it's kind of similar to this medication, but it just have only one effect. And this Mounjaro has a dual effect. Now, the other contraindication to this medication is if you have a history of pancreatitis, which is the inflammation of pancreas, acute or chronic. That could be one of the contraindication. So if you do have similar history, you want to share that with your doctor. Pregnancy. Now, any weight loss medication, if you have a history of pregnancy, you should not be on any weight loss medication. Okay. Now, birth control pills. If you're a female and you're on birth control pills, what happens is that, as you know, if this medication make the stomach sluggish, the birth control pills that you're taking, they might not be that effective. So your doctor has to find other options for the birth control if you're going to be on the Mounjaro. Now, kidney disease. If you have a history of kidney disease, chronic kidney disease, you wanted to make sure that you share that information with your doctor so that he or she will know there might be one of the issue that they need to look into that. The other issue they want to talk to your doctor about to see if you're on any other medications, such as insulin or such as glimepiride, that is for the diabetes. Most of the diabetes medication that causes hypoglycemia, which is mean low sugar, then when you start on Mounjaro, you have to be more careful so that you don't get into this episode of low sugar or hypoglycemia. You certainly don't want to never mix this medication with insulin and inject it. If you're going to give the insulin and this medication, usually you want to do it in the two separate locations. And when you inject this medication, you have to, basically change the locations of the injections every week so that you don't get into any skin problems. Okay. So we talked about the just kind of major contraindications. Now, what are some of the warnings and side effects of this medication? So let's talk about some of the warnings. Now, one of the big warning is usually when you start on this medication, in the animal studies with rats, rats, this medication was known to have probably caused some of the tumors in the thyroid. So the warning would be if you are on this medication and you feel a little bit of nodule or swelling in your neck. So you want to share that with your doctor right away. If you're feeling a little bit shortness of breath, or you feeling, I talk about the lump in the throat, or if you're feeling difficulty swallowing, you want to talk to your doctor immediately. So these are some of the warnings that goes with this medication, so that you know about them. Now, what are some of the side effects? So the most common side effect of all these medication with the similar group is usually it causes a little bit nausea. Sometimes it can cause vomiting, some bloating, a little bit of headache, which is generally the some of the symptoms. They usually go away over a period of 2-3 weeks. But if you start feeling intractable vomiting, abdominal pain, severe abdominal pain, and those pains are not going away, you wanted to contact your doctor right away because there might be those signs symptoms might be due to possible pancreatitis or the inflammation of the pancreas. So you want to make sure that you discuss that with your doctor. If you feel like cold extremities, feeling like passing out, and things like that, those could be the signs and symptoms of that your sugars are going low or you becoming hypoglycemic. So that's another thing that you want to talk about your doctor. There are people who might be allergic to this medication. You might, break into hives, or you might have a difficulty breathing, or a throat problem that could be allergic reaction that you need to talk to your doctor or get to the emergency room immediately, right? If As a side effect of this medication, if you had too much nausea and vomiting and you get too much dehydrated, you can get into the trouble with kidneys and you can have a kidney failure due to that medication. You might start having some swelling in your face or things like that. So then for possible kidney failure, as a result of too many vomiting and nausea and abdominal pains, and there is a possibility, that you might have acute kidney failure. So that might require immediate attention from your doctor. You might have a lot of stomach aches, Now, as a result, it does not usually cause any ulcers or any gastritis, things like that. But there's something to be alarmed and to discuss it, with your doctor, right? So okay. So now, let's talk about the FDA approval process for the weight loss. So this medication was approved in May 2022 for the diabetes mellitus type 2. And then on October 6th, that this company, they announced that they have submitted data to the FDA to start with the SURMOUNT 2 trial or phase 2 trial. And that phase 2 trial was basically focusing only the weight loss. So they wanted to follow the people with diabetes and their weight over a period of 10 weeks to over the period of 12 months to 10 months or whatever. So they've been submitting their data since October 6, 2022. And that trial, that data has been, the FDA has been getting that data, right? And it is possible that this medication might get approved right away for the weight loss, probably in April 2023. So now we are in March. So maybe in April it's possible that they might approve it through the expedited process. What that means is that usually, if the FDA feels that there is a need for fast tracking designation for a medication, then what they will do is that they will not wait for the study to end and make their determination. They will keep getting the data from that phase 2 trial, and if they have enough evidence, and if they think that the people is going to benefit from this medication right away, so they might not even wait for the conclusion of the whole trial, and they might get the approval process. So I will not be surprised if this medication get approved soon. My guess is that if they're going to approve this medication in the next 4 to 6 weeks, which is April or May of 2023, they might give a different name. I'm just guessing. So to the same medication, so that there is a distinction who takes it for diabetes and who takes it for the weight. That's what the previous companies have been doing, generally speaking. So this is we are with the FDA. And the reason is that the first study was significant for 25-pound weight loss, or about 15 to 20% weight loss in the population. My personal experience, I have quite a few patients on a Mounjaro, and actually they're getting wonderful results with this. But to suggest that they're getting wonderful results because they are on Mounjaro only, that I will be totally wrong, because the medication only works. Any weight loss medication, I will repeat, any weight loss medication will only and only work together with diet and lifestyle modifications, which is diet and physical activity. If you do those things, then this medication is going to be helpful. Okay. So, and the last thing that I want to talk about insurance coverage, and how to go around to see if you can get this medication approved. Now, first of all, I will include a link in the description of this video that you can go to the company website, and you can see, and they have this process that you can get a $25 you can get the $25 saving card. What that means is that you can get approved only for $25 a month supply for a period of 3 months. Remind you that this medication is about $1,400 a month. So it is important for you that the insurance pay for it. If the insurance does not pay for it, then become a challenge. But if you have a commercial insurance, and I have no idea and why only the commercial insurance people who have the commercial insurance are the only one who can qualify for this $25 saving card that you can get it, and the first 1 month to 3 month supply you can get it 25 months each. So probably there will be like $75 for the 3 month supply, and after that the company probably hope that the insurance will pay for this medication. So that's why they, if you have a commercial insurance, they probably will give you that saving card through them. It is, and my guess is the reason is that they don't want to give this $25 saving card through the Medicaid and Medicare holder, which is the government insurance holders, is because they know that the Medicare and the Medicaid does not cover this medication, period. Which is sad because if there is a medication and if it's approved for the commercial insurance, then it should be approved for the Medicaid and for the Medicare recipients also, because we are all human beings, and if we have different insurances, what does that matter? And I think that's something that need to be focused on in the future, through our congressmen, through our legislation, through our systems, so that the people who are suffering and dealing with their obesity and unhealthy weight, so that they should be equally able to get approved for these medications, the new medication for diabetes and for the weight loss, the same way they get approved for the commercial insurances. Which is something that need to be talked about further. Right now, this medication is only approved for diabetes mellitus type 2. It is not approved for type 1, and it is approved only for the people who are age 18. So if you are 18 and above, you can get it approved. And also, for the approval process, when you talk to your doctor, if you have diabetes or if you have pre-diabetes, they might be able to submit that information to the pharmacy. So this company, they have one or two particular pharmacies, and your doctor, your weight loss doctor, will know that to submit it only through those particular pharmacies, because they are the one who usually get the approval for you. They hassle with your insurance companies to get it approved for you. Sometimes if your medication does not get approved, that will be the time that you get on the phone, call your insurance company and ask for the member services department. Those are the people that deal with the member's complaint, and then you talk to them that this is my diabetes, so this is my weight problem, and everything has been failed, and why it is approved. If it's too much pressure, probably some of these insurance companies, they might try to get some of these things approved. Again, thank you. I think I took a little bit longer, just to do this video, and I'm hopeful that was useful. Have a wonderful day, and see you in the next video.